We would like to take this opportunity to welcome you to Nursing 150. This is an exciting course with a lot of material that you will find hopefully very interesting, and a lot of material that you will use every day in your practice as a nurse. A lot of students feel that this course is a great course as far as beginning to feel like you are learning nursing critical thinking, nursing knowledge. We will begin to discuss more about medications and their effects on the patient and their disease processes. On top of that, the test questions begin to be more of an application type question rather than just an understanding and memorizing type question. And so we have found that it can be a little bit challenging for students to kind of develop skills to answer questions that are applications questions. And that's why we've developed this sort of introductory presentation to kind of discuss that and help you develop those test-taking strategies to be successful in Nursing 150. So one of the number one questions that we get is, or statements from students, is that they say, I've always been a good student. Why do I need test-taking strategies now? I've been a straight A student. Well, and here's some of the answers to that question. These are some examples of how we answer that question. Nursing exams are different. They do ask you to apply information and to make judgments rather than just recall facts. And you may have noticed that so far in some of your test-taking experience so far in the nursing program. Another way to answer that is test-taking strategies can definitely help you be successful in nursing school. As the statement states, research has demonstrated that regardless of how similar the education background and training of any two students may be, the test-wise candidate will score higher on average than the less skilled test taker every time. So that is hopefully that kind of answers that question. These questions are meant to be more of identifying whether you can critically think and make nursing judgments rather than just memorizing material. So some test-taking techniques that I'd like to go through with you in this presentation are determining the parts of a question, so we're going to talk about that, identifying the critical elements of each question, and how to eliminate incorrect options. In your experience thus far, you may have noted that there are often questions that you have 4 choices in the multiple choice questions, and a couple of them are very similar, and you might get stuck between 2 of them. So hopefully with this presentation we can talk about how we can eliminate the incorrect ones, how you can pick the most correct answer. Okay, going a little bit further into the parts of each question. Each question has 3 parts, the first being some kind of a case scenario or a situation. And so it's important that you be able to read the case scenario or situation and to be able to determine what the situation is. And then the stem of the question is the piece that actually asks you to select an answer. And it's important to decipher from this piece of the question, what is the question asking? So as far as the case scenario, it's telling you, what is the question telling you? And then the stem, what question are you being asked? Sounds very easy. However, it is important that you clearly understand what you are being told and that you clearly understand what you're being asked. Some of the mistakes that students make is that they will kind of make up a piece of the scenario that's not in there. So don't make up anything that isn't in that question. Don't kind of make up your own scenario. You really need to take the question for what it's worth and be able to clearly reword the question in your own words of what it's really telling you and what it's really asking you. And we'll talk about that a little bit more in the next few slides. So this little acronym of POW is basically being able to fit the question into your own words. So reword it to better gain understanding of what really is being asked of you. And again, so that you don't create a scenario that doesn't exist, that you don't try to make up something that isn't there. What is the question really asking is what you're asking yourself, and then you're putting it in your own words. We have a few examples that we can practice on doing in the next few slides. Some of the key words to pick out, and those piece of the scenario and in the pieces of the question are listed here. And they can kind of help point you in the direction of picking the right answer. When you see things, what is the most important thing for the nurse to do first? What should the nurse do initially? What is the least important thing? So that would be a negative ending question. So we'll talk about how it can be negative or positive, and just be able to kind of pick out some of these key words in order to be able to identify which answer most accurately answers what the question is asking you. So this is an example question that we can look at and try to identify the parts of the question and also reword the question in a way that we can understand and helps us to identify what the question is really asking. First of all, case scenario piece of the question. So in preparing to administer a medication to a confused elderly patient, the nurse discovers that the patient does not have an identification bracelet on. The patient states that the medication has already been taken. That piece of the question there is the case scenario. And so once you identify what's the case scenario, then you start looking at key factors and kind of rewording what this is asking you or telling you the case scenario. So as far as for me, I would look at this and say I'm going to administer medication. I have a confused elderly patient. So I'm getting ready to administer medication to a confused elderly patient. And so I begin to think about what that means. Safety is an issue with administering medications, especially if I'm getting ready to administer it to a confused elderly patient. And then the nurse discovers that the patient does not have an identification bracelet on. Again, a safety piece of administering medication. So I feel like in looking at this, I have a couple of issues here that I'm going to identify. I have a safety piece due to an older, confused patient. I'm running out of room here. And then the other second piece of this safety part is this identification bracelet. I don't have any way to identify this elderly, confused patient. The patient is telling me that they've already taken their medicine. So just kind of really looking at that. Safety seems to be a major issue here, and there's two reasons why there's a safety issue. I have a confused elderly patient that I do not know, have any way to identify them, and then the patient is telling me that they've already taken medication. So I kind of have two major problems here. So then we look at, what's the question? What is this really asking me? I see what it's telling me. I see the case scenario, the scene here that it's telling me, and now I need to know what it's asking me about this case scenario. So it says, which of the following nursing actions provides for the patient's safety? So I understand in my case scenario, some of my problems are that I have a confused elderly patient with no identification, and I'm trying to safely administer medication to this patient. And so they're asking me, how do I safely do this? And this slide is just kind of reiterating kind of what we just talked about in the last slide. But it's also showing that the STEM, the question part, can be a true response STEM. The true response STEM meaning which nursing action is the most important. These are some examples. So it's basically wants you to identify the most important thing. The second example here says the nurse knows that the client understands the teaching when the client does which of the following. So these are positive answers, so they are called a true response STEM, in comparison to a false response STEM. And you've probably seen some of these questions before. So they're wanting you to identify the one that the nurse should not do, or identify something that is false. So examples of that are the least important, there's that key word there, the least important concern for the nurse to raise with the client. So it's wanting you to identify the one that's, as opposed to where you have the most important, now we're going to the least important. So it's important to be able to look at those words and really understand what it's asking you so that we can identify the correct answer. The patient requires further instruction in CPR if the client's hands are placed. So in this one, we'd want to pick the one where the hands are in the wrong place. So again, that would be a false response stem. So it's important to kind of be able to identify that you could have a true response stem or a false response stem, and just to be able to be prepared for that so that you can identify the correct answer. Once again, just bringing that same example of a question up, identifying the stem part and what it's asking you. This is the stem we've already identified. Which of the following nursing actions provides for the patient's safety? And you would ask yourself, is this a true stem? Is it wanting me to identify the true answer, or would this be a false stem? Well, it's asking me which of the following actions provides for the patient's safety, and so I'm going to pick a true response stem. That means, what is the true answer here? And then moving on to looking at the 4 options if you have a multiple choice question. Typically, there are 4 options to choose from. You have to pick the most correct answer. Here's a few ways to kind of help you identify those. Typically, you can eliminate at least 2 options. Usually, you can eliminate it down to getting rid of 2 of the options. You're like, those are incorrect, and then you kind of get stuck between 2 that are similar. And so after you eliminate an option, you should not go back to it. That just kind of helps you kind of organize picking the correct answer. And then utilizing the nursing process, which is assessment, diagnosis planning, implementation, and evaluation. If the question is asking you about assessment, then you should pick an assessment answer. And in the next few slides, we have some tips on that as well. Again, some more tips for picking the most correct answer. Look for the most global answer. So it's the one, by that they mean picking the answer that answers all of the question most accurately. And I've got some examples of that that will kind of help understand that. So basically, sometimes it'll give you an answer that's correct. However, it doesn't cover all of the problems that are being presented in the case scenario. So that's what this means by the most global answer. So the one that answers the answer most accurately in most cases. So instead of like a very specific answer, some answers are very specific to maybe a certain type of patient, and so we're looking for the one that's usually most global. Look for similar distractors and eliminate them. So each question, each of the 4 options, there'll be some that are meant to be distractors. They are there to kind of pull you in to see if they can tempt you with maybe just a little bit different wording of an answer. So it's important to be able to know that there's distractors there, be able to identify them, and be able to eliminate them. A similar word or phrase used in both the case scenario and one of the options. So you kind of look like, again, like I said, and we'll go over a few examples of this, basically looking at that question and answering what it's asking you, and very, not making up anything in this scenario. You're answering what the question is telling you and what it's asking you, and there might be similar words or phrases that you can identify to help you pick out the most correct answer. So going back to using the nursing process for picking the correct answer, it's always important to assess before you act. Question regarding care that includes both assessment and implementation. Is there enough information given to take an action? Typically, you're going to want to assess your patient first. Eliminate the implementations first unless you are certain the question gives you enough information to take action. If the question does not give you enough information to act, you must assess your patient. And so most NCLEX questions, most standardized tests, most of the tests that we give at the college, we are wanting to make sure that you can identify your priority as a nurse if you are in the room with a patient. And typically assessment is checking out your patient and looking at your patient is going to be high on your priority list. And then eliminate answer choices that have unnecessary assessment. So, if the question is telling you have a patient who has an oxygenation problem and it's talking to you about toileting, then it's probably not related to your question. So those are just some tips to kind of help you pick the most accurate answer for your questions. And again, prioritization, again with assessment. If you see the words most, first, best, initial in a question, this means you should establish priorities. Typically in nursing, priorities are based on airway, breathing, circulation. Those are priorities, and those are based on Maslow's hierarchy of needs. I don't know if you remember those, but this is kind of a little reminder for Maslow's hierarchy of needs. Essentially, this is where we start with our patients. We make sure that they have their physiological needs first. And so when we're looking at prioritization, as far as words like best, priority, initial, first, we're going to be looking at those physiological needs such as breathing, food, water, sex, sleep, homeostasis, and excretion. Those are going to be your high priority needs of your patient. So if you had a choice between, food and self-esteem, of course we have to pick the most, as far as prioritization would be the food first. So just think about those types of things when picking your answer. And again, just making you aware that there are distractors. They are intended to distract you from answering correctly, so try not to be sucked into that. They are incorrect options that are designed to resemble the correct answer. So again, we'll look at some answer choices and kind of help you understand what that means. But I think it's important that you are aware that there are distractors intentionally put in there, so that that can kind of help guide you to the correct answer. So practice question. What information is most significant for the nurse to include when teaching a patient with newly diagnosed hypertension? So first of all, we have to identify the case scenario. So the case scenario is that we are teaching a patient with newly diagnosed hypertension. So teaching, that's part of the nursing process, which is implementation. And this patient is newly diagnosed, and the question is, what information is most significant for the nurse to include? Well, if we looked at number one, or A, increasing physical activity will control blood pressure for most patients. We do know that increasing physical activity can control blood pressure. But this interesting word here that says for most patients, that's kind of a vague thing to say to a patient, and we're looking for the most significant thing that newly diagnosed patient needs to know about their hypertension. So looking at B, so I'm kind of I don't think I like this because I don't like the way that it says most patients. Because remember, we're looking for a global answer. Most patients are able to control their blood pressure without medication. Well, some people can control their blood pressure without medication, but again, we have that tricky little word there that says, most patients. And again, we're looking for the most significant thing. So the most important thing that this patient needs to know. So I'm not real crazy about that one either, because again, remember, they're worded similarly. A lot of the distractors are. All right, C, annual blood pressure checks are needed to monitor treatment effectiveness. So That's true. That we, once somebody's diagnosed with hypertension, we should monitor them. But there's this funny little word here that says annual. Annual meaning once a year. And again, let's look back at what this is asking us. A newly diagnosed hypertension. So basically what that tells me is we would treat them and then we wouldn't have them come back for a year. We'd check them in a year, which is, we know that that's not correct. We would have to monitor them closely, especially if they're newly diagnosed. Not a good global answer. D says hypertension is usually asymptomatic until organ damage occurs. So that's a very true statement. And it's not saying most hypertension. It's a very strongly worded. Hypertension is usually symptomatic until target organ occurs. So if you looked at your choices here, this is a very global answer. It's very important that patients know that hypertension is asymptomatic because that means they won't feel bad. And a lot of patients are non-compliant because they don't feel bad. So the reason I bring this question as an example is because all of the answers are pretty correct, actually. They're not necessarily horribly wrong statements about hypertension, but we want to know the most significantly correct answer. And as far as globally, a very important thing that we would need to tell them is that you're not going to feel bad, but you still need to be treated. And if you leave it untreated, you're going to have target organ damage occur. So hopefully that's a little bit helpful in helping you understand how that you have these distractors and how to pick the most globally correct answer. Here's the answer with rationale. Hopefully, like I said, D is the answer. Hypertension is referred to as a silent killer, and patients may often not have symptoms, and therefore it can be hard to stress the importance of taking medication to control it. So hopefully that kind of guides you through how, some of these questions can have a lot of distractors, but we really need to clearly read through each answer and pick the one that is the most correct in that situation. A lot of students have trouble with select all that apply types of questions. A good rule of thumb is to treat each answer as a true or false response. So basically, as you read the question, you read the scenario, and then as you read each answer, you say, okay, is this true or false? Is this true or false for this question? And then hopefully that will help you to eliminate the ones that are false and pick the ones that are true. This is a very good technique for select all that apply, and I highly recommend it. All right, going back to that initial question that we had for practice. In preparing to administer a medication to a confused elderly patient, the nurse discovers that the patient does not have an identification bracelet on. The patient states that the medication has already been taken. Which of the following nursing actions provides for the patient's safety? Again, our question, what nursing action provides for the patient's safety? With a scenario with a confused elderly patient without a bracelet and who says they've already taken their medication. So let's look at answer number 1. Ask if the client might be confused about taking the medication. So we could do that, but what the key word here is that the patient is confused. And so the patient could say, yes, I've taken my medication. But we know that that could be not quite accurate because we have this word confused in here. For answer B, identify the client based upon which bed is occupied in the room. Well, clients can often wander and can wander into other rooms. So is this the most accurate way to safely provide for this patient's safety? I'm not sure that would be the best way, because we know that another patient could have walked into that room, or it could be a visitor for all we know. So let's look. I'm going to eliminate that one myself. So let's move on to C. Check the client's chart and ask another healthcare worker to assist in identifying the patient. Okay, that could be helpful. And if you look at this kind of helps us with a couple of the problems. Another healthcare worker could help us with this identification issue. Checking the client's chart could help us look to see if anybody has documented that there's been any medication given already. So I kind of like this one because it is, again, like a global answer. It's identifying and addressing those different problems that I've seen in my case scenario. So I'm gonna keep this one checked here for the moment. On D, ask the client's name and then obtain an identification bracelet for the patient. Okay, not a bad idea. However, we have again said that this patient is confused. And so asking the patient and then just getting a bracelet might not be the safest thing to do. Because again, we have a confused elderly patient and we're talking about patient safety. I'm going to go with C right here because I think it's the best idea here for my patient's safety. And that is the correct answer for this question. So hopefully just exploring this question, looking at the question first and looking at your options was helpful in helping you into some test-taking strategies. Final thoughts on this. We will work on this throughout the semester. And I encourage you to seek opportunities to improve your test-taking ability and test-taking strategies. Some final thoughts here. Again, think positively and believe in yourself. That is a very important thing, to come into every test positively believing that you can do it. Positive self-talk, avoiding negative people. Always eating healthy, that builds up your stamina, makes you feel good, prevents you from getting fatigued while you're in the middle of a test. So does rest. Rest does the same thing. And dressing comfortably, just so as you sit there taking your test, you're comfortable, and just being there and being in the moment, being able to breathe, and that is so important. We look forward to a great semester. We are here to help with positive reinforcement, with positive self-talk, and doing a lot of learning and helping you to learn. It's a great feeling to be successful, and we want to make sure that happens for you.